Sanjay Gupta. I'm a consultant cardiologist in New York, and today I wanted to talk about statins. Now, this is a subject that a lot of people have asked me to do a video on because a lot of people are either taking or are told to take statins. And there's a little bit of confusion around as to who should take them and what they actually do. So the first thing to say is that when you're looking at people with heart disease or people who are at risk of heart disease, the way heart disease happens is that the blood vessels that supply blood to the vital organs, i.e. the brain or the heart, can get narrowed. And they often get narrowed because there's deposition of fat, and that causes the arteries to harden and narrow, and eventually, if they're narrowed to the extent that blood can't actually get through the narrowing to the heart, or sometimes to the brain, then that can cause damage, and that leads to either a heart attack if the blood can't get to the heart, or a stroke, which is like a brain attack because blood can't get to the brain. So cholesterol is a compound found in your body, which in high levels can be deposited in the blood vessels, the arteries, and that causes a fatty plaque to develop in the blood vessels. So cholesterol is something which is normal. We all need some cholesterol, but in excessive quantities, it can deposit there and it can cause buildup of plaque, which in the long run can cause obstruction to blood flow. So the first thing to say is that a lot of people have been targeting cholesterol and saying, well, you know, if you can lower your cholesterol, if you can reduce your cholesterol, then you reduce your risks of developing heart attacks or strokes. Now, one of the agents, there are lots of agents that can reduce cholesterol, but one of the agents that can reduce cholesterol are called statins. And statins are very popular and commonly prescribed because there have been lots of studies which have been shown that if you have established heart disease, if you already have some buildup of plaque, then reducing your cholesterol levels or taking a statin can improve your prognosis in the long run. Now, a lot of people ask me, should everyone be on statins? And the answer is this. To my mind, there are two sets of people who need statins, okay? Some people, there's this common misconception that cholesterol is all about what you eat. You know, a lot of people come to me and say, oh, my cholesterol is 6, but I eat really healthy. It's true. It can be because of what you eat, but also there can be some people who actually have, who cannot break the cholesterol down. So they have an inherited gene defect, which means that they can't break the cholesterol down. And these people are people who have familial hypercholesterolemia. So it's always worth having your cholesterol checked, because it may not be because you're not eating healthy. You may be eating very healthy, but you may have this defect in your genes, and therefore you can't break down your cholesterol. And particularly if you have a strong family history of heart disease, then it's always worth getting your cholesterol checked, okay? Because it could be this thing called a familial hypercholesterolemia. And if you have a familial hypercholesterolemia, then there is no doubt in my mind that you should have your cholesterol reduced by medications. If you don't have familial hypercholesterolemia, i.e. your cholesterol is not unduly high, you don't have a significant family history of heart disease, then you don't need cholesterol lowering tablets. You can do this just by lifestyle. And lifestyle doesn't just mean eating healthy, it means, sure, you eat, you know, less chocolate, less cake, all that kind of stuff, but also paying attention to eating less supermarket food, which has got lots of preservatives, which has got lots of additives, getting regular exercise, getting lots of good sleep, and those all contribute to keeping you healthy. So if you have familial hypercholesterolemia, if you have a deficiency in an enzyme which breaks down your cholesterol, I would strongly recommend that you take a cholesterol lowering agent, because although the cholesterol lowering agent is not going to do anything in the short term, in the long term, it can reduce the likelihood of cholesterol building up in your arteries and therefore reduce your risk of having heart attacks or strokes. The other group of patients who should have cholesterol-lowering tablets are people who have established disease, so in whose arteries there is already evidence of deposition of fatty plaque. All right? In those people, I think it is really important that you take a statin. Why? For lots of reasons. People think it's all about cholesterol. You know, the lower your cholesterol, the better it is. It is a little bit about the number, lowering the cholesterol, but also statins have other effects, which I'm going to talk to you about, which can be very beneficial in people who have vascular disease. So let's try and work out the mechanism by which heart attacks occur if you have some buildup of plaque in your heart arteries. There are two mechanisms, okay? The first mechanism is you get a layer of plaque, and if you don't do anything about it, if you keep leading a bad lifestyle, if you keep smoking, if you don't pay attention to your cholesterol, that will progressively get worse over a period of time. Eventually, it'll cause a significant narrowing, and you will start getting symptoms of a reduction in the blood supply to the heart. So you will start getting symptoms of chest discomfort on physical exertion, because when you're exerting yourself, you're asking for more blood, and the blood can't get through the narrowing quick enough. And people will often then say, I walk a certain distance, I get a discomfort in my chest, and then when I stop, the discomfort goes away. That is classical angina, okay? And that is caused by progressive buildup of plaque in the heart arteries. And so taking a cholesterol-lowering tablet will reduce the chances of progression of buildup of plaque in the heart arteries. Then there is another group of patients who may have a little bit of plaque, who have no symptoms, but then suddenly drop down dead because of a heart attack, or suddenly have a heart attack with no warning, out of the blue. And the majority of people who have heart attacks do have heart attacks because there is no warning. Because if you had the previous situation where you had a gradual buildup, you'd get a warning, and you would then go to a hospital and say, look, I'm having this problem. Someone would check you out, and they would find what the problem is, and they would either put a stent in or do a bypass. Sorry, I've got the flute. Now, the worst scenario is where you may have a patient who has no warning whatsoever. So they may have a little bit of buildup, but what tends to happen is that plaque can be unstable. And what makes it unstable? The amount of inflammation your body is under. So the amount of stress, the amount of sort of whether you smoke. And that inflammation can cause the plaque to rupture. And when that plaque ruptures, immediately what happens is the body thinks you've sustained a wound and forms a blood clot within a few seconds or a few minutes. And that blood clot inadvertently blocks off the supply to the heart, causing the heart muscle to die. And that's what a heart attack, that's how a heart attack happens. So in those people, what we have found is that statins have an anti-inflammatory role. They have a plaque stabilization role, i.e. they take plaques which are hot and therefore more likely to rupture, and they cool them down and make them less likely to rupture. And they also have a very potent anti-inflammatory effect, because we know that the majority of times it's some form of inflammation which causes the plaque to rupture. So statins, and this is not true for all cholesterol-lowering tablets, it's true for statins, however. Statins can stabilize plaque and have an anti-inflammatory role. So those are the two sets of people I think should have statins. People who have a familial problem whereby they can't break down their cholesterol, and therefore you should treat the cholesterol aggressively, and people who have established vascular disease. Now you may say to me, well, how do I know I have established vascular disease? Until recently, we used to do this by working out your risk. So if you had diabetes, if you had high blood pressure, if you'd previously had a heart attack or angina, then we would be pretty confident that you'd have some vascular disease, and people would therefore recommend a statin. Now we have better technology, so you can do something called CT coronary angiography. You can look at your heart arteries, particularly study the walls of the heart arteries, and if your heart arteries are clean as a whistle, then you do not need a statin. But if your heart arteries show any wear and tear, any small amount of probably a good idea to be on statins. It's important to realize that when you take statins, you're taking them for life, number one. It's not a case of you can take them for a few days and then discontinue them. You take them for life. The second thing to realize is that whenever you're given a tablet, you have to ask yourself, is it going to make me feel better or is it going to make me live longer? Statins will not make you feel better. In fact, they could actually make you feel worse because they are often associated with side effects. And at least 5 to 10% of patients complain of muscle aches and pains when they take statins, and some of them actually have to come off the statin. So statins will not make you feel better, but in the long run, they can be beneficial in those two groups of patients. In the very elderly patients, a lot of whom have vascular disease, you have to ask, do they need statins? Well, the question really is, how much benefit are you going to gain in a person who's very elderly in terms of lengthening lifespan? Because as a person gets older, say a person is 85, lengthening their lifespan, what you can do to lengthen their lifespan gets less and less, and therefore their quality of life becomes more important. So I would certainly not give a statin if it's making someone's quality of life worse, particularly in that age group, because I don't think that the statin would have that much of a benefit in terms of their lifespan, in terms of improving their lifespan. The other thing just to bear in mind is that all these things are fine. Statins maybe, they've been hailed as this miracle thing, but actually just paying attention to your diet, avoiding processed food, making sure you're getting enough magnesium in your diet, because magnesium has an anti-inflammatory role as well. And magnesium has effects on cholesterol as well. So paying attention to your magnesium is really important. Getting lots of regular exercise is really important. One, because it's anti-inflammatory. Two, because it'll tell you if there's a problem, because the first time you'll notice a problem is during exercise. And three, getting good sleep. And number four, obviously having a healthy mindset, not getting unduly stressed, trying to keep life simple. Those are the important things. If you do those, you don't need to rely on these tablets, on extra medications to try and work on your risk, i.e. avoid getting heart disease in the first place, rather than relying on medications to try and mask it once you've already developed it. So I hope this was helpful, and I look forward to hearing what you guys have to say about this. It's Christmas time, so I wish you a very happy Christmas, and I'll keep in touch. You can now get in touch with me on Facebook. So they've changed my Facebook page. Previously it was Your Cardiology. Now I think you have to type in my email address and it'll take you to my Facebook page. I'm also on Twitter, and I have a website, and this is probably the best way to get in touch with me. I look forward to hearing from you. Thank you so much. Bye.